So I want to start this out, and there's a technology I can look up here. I'm going to start this out with a movie that my daughter made. She goes around the country speaking about ADD and things like this. This movie is very professional. It was done by Chris Bell. Chris Bell is a documentary filmmaker. He has quite a few films on Netflix. And it's very short, but I just want to show you. She's going to explain kind of what she went through. And I think it's a good way to start. Sorry about that. Well,
he threw my calculator across the class and started screaming at me in front of everybody. And it was like...
try this again. I might get this down.
They say a child's greatest joy is living. For me, it was my biggest fear. I remember on my first day of school, the teacher told everyone to hang their book bags underneath their names. And I stood there just in total confusion, trying to figure out which one my name was. That was my first memory of realizing that I had a problem and that I was different from the other kids. I was dyslexic, so the words were jumbled and numbers didn't make any sense. I was using a calculator in 5th grade, and my teacher got frustrated that I was using a calculator because I had the math was at a math level of like first grade, so I used a calculator in 5th. And he threw my calculator across the class and started screaming at me in front of everybody. And it was like, it was just all this negative reinforcement constantly. It was just a nightmare. I had such anxiety about going to school, and I was made fun of. I was bullied. Kids would tell me I was stupid. They would say stuff behind my back. And on top of that, the teachers would too. And when I was a teenager, I remember being in gym class and deciding to push myself to run the mile. I'd always been told not to participate in gym class because I had poor coordination. And one year I just said, you know what, screw that. I'm gonna run the mile, and I'm gonna prove to myself that I can do this little task. Because if I can do this, then I can do anything. That is what changed everything for me, is finding fitness. My dad taught me how to lift. It was the first time that I actually felt like I was good at something. It gave me all the self-confidence and that reassurance that I had been needing so much in my life. I started to embrace my differences. The things that held me back were the things that pushed me. Attacking your biggest fear doesn't make much sense. But when you do with every ounce of your being, they'll call you names. Champion, warrior, winner. I'll take that.
So she did that. I didn't know she did it. But what I like about it is that she covered all the important
With
things.
Wix, you can create a professional
Oh, my.
website that looks stunning. Just go to Wix.com. The best part is, you can update it and keep it fresh whenever you want. I like changing up the background.
So, she hit all the important things. You put your child in the classroom, and you don't know what you're getting. Is somebody helping her ego? Is somebody crushing her ego? And maybe they think they're helping her. But they may be crushing, your child over and over again, and that doesn't help. So it's important. You got to be an ego builder. And we'll go through all these things today. But just understand, we want to have a few. We want to look at a couple things. There's ADD and there's ADHD. Some people, sometimes you just don't understand the difference, and the difference is kind of subtle. So this is a panel that kind of tells you that. But for simplicity, I'd like to describe it this way. If you take a bunch of kids and you put them out on the playground and they're all running around screaming, they're all the same, right? And then you bring them back in to sit down in the classroom, and one or two or three of them are still running around screaming. They may be the hyper ADD, ADHD kids. So they look okay out in the playground, but they don't look so good in the classroom. So that may be your classic ADHD kids. The ADD child may be more like a space cadet. Like they sit in class, they look like they're watching, they're quiet, they're not interrupting. But then you ask them, what did we just talk about? And they may not be able to tell you what that was. So subtle differences. There's other things that come into play here. Could there be dyslexia and other things? So we'll kind of go through a lot of that. We gave you a handout. We gave you a handout. This stuff's not in the handout. The handout's really the information. And by the way, as we're going through this, I also have a test that anybody wants to take. And after we're done the talk, I'll go over the test and we'll see. And by the way, this could work for adults and children. It's a little more children-oriented, but if you think back, this is what happened to me, I'll be able to look at that and tell you some more information about what's going on. If you have a child and they're not diagnosed, or you think they're diagnosed improperly, the test will help us pick up on that. This particular slide tells us that the incidence of ADD, ADHD seems to be on the rise. It just could be that we're identifying it more often. Maybe we just haven't been identifying it. And suddenly, boom, it shoots up. Or we may actually be seeing more, I don't know. Because of the way the statistics are, we don't have a lot of 1950 numbers to look at. Because number one, they weren't looking for that. So it's a little iffy as to what's going on. Is the diet making kids more ADD? Is something, because you know what? The medical community didn't grab enough information or keep enough information or have the insight into what information we should be keeping on this. And maybe they didn't even care in 1950s about this. Yes? I don't. That's interesting. Okay, so what we don't want, or what you should want, is this. Identifying a child that way, I mean, it can be very depressing for the child. It's anxiety-provoking. You show me a child that has been diagnosed with ADD, and I'll show you a child that has anxiety. And that makes it a little rough to diagnose, because you have to separate that out. Now, at the Abington ADD program, we rejected 50% of the people, the kids or adults that came to us, because we felt they had concomitant, or they didn't even have ADD, they just had anxiety or depression. So we took out about 50% and said, we're sorry, you're not the right candidate for this course, or for this treatment. And the treatment basically was non-drug treatment. We do the same treatment here. Basically, we use biofeedback, and we teach techniques on concentration and focus. I'll get into that a little more too as we go along. And I think right now I want to pop up the what you have in your packet, the outline. That's what we're going to go through right now.
Oh, that's right. This is fine. Cheers.
All right, so basically what we're going to give you today is really what you need to know to interact with either teachers, practitioners, if you're an adult and maybe you're working in a setting where you got to perform, you know, in front of a sales group, whatever it might be. You could be a teacher in a setting where you're, you know, under a lot of pressure. We're going to try to bring that into focus for you. So basically, here's the definition again. I don't want to spend a whole lot of time on the definition. We have ADD, which is, like I said, kind of space cadetish, and we have ADHD, which kind of has a hyper component. And if you look at a child long enough, you can pretty much pick up on what's going on. You can see it in adults also. It's pretty obvious if you're thinking that way. Symptoms. So this is kind of important. So we have disorganized, lack of focus, hard time paying attention to details, tendency to make careless mistakes. The work can be messy, it can seem careless. Handwriting can be really bad, and a lot of ADD children never actually master cursive. You end up just printing all the time, all the time. Do we have any teachers in here?
Not too bad.
No teachers. Okay. Usually get a teacher that shows up. Preschool? Okay, well, they're not writing in preschool. A little bit? Mm-hmm. Yeah, okay. They can be forgetful, memory loss, as adults, missing appointments, having trouble keeping a schedule, that type of thing. Easily distracted, so you have distractibility, impulsivity, just general confusion, memory losses, all kinds of things that can go on. Now, kids with hyperactivity can seem even more problematic. So they're fidgety and they squirm a lot. They get up and move around inappropriately. They're great running and climbing outside, but if they keep doing it in the classroom, they tend to seem disruptive, so the teacher gets upset. They may have trouble playing quietly and doing, you know, hobby work where they have to sit down and really do something. That's the child that's running around the table looking at everybody else and that type of thing. On the go, talks excessively, a lot of hyperactivity. They may also have impulsivity, and you can tell an impulsive person. They talk over you, or some of our things are impatience. They can't sit and listen for a long period of time. As I go through these, you may be noticing them in yourself. I mean, it's possible. Having a hard time waiting to talk, talking over the person, hard time waiting for your turn, blurting out answers, frequently interrupting, intruding on others' conversation, not fitting in socially quite right, starting conversations at inappropriate times. So, what do we do about it? Well, what has been done in the past? When I started my little educational beginning with this, all they had was Ritalin. And teachers would say, oh, put your child on Ritalin, like they're the doctor. You know, very inappropriate. What I discovered was that Ritalin, which was originally a weight loss product, came from the weight loss days where they used amphetamines when they were still not controlled substances. Doctors would give them out all the time. And what happened was the government decided they were very addictive. So they passed a law making them, I think, a class 3. And Ciba-Geigy, who owned rights to, maybe they didn't, I forget, but they owned rights to it anyway to market it. They were kind of stuck with a new weight loss drug with no indication, or it would be hard to sell. It killed that business. So they said, well, what else can we use this for? It's not a true amphetamine, so it's got to maybe it doesn't sound so bad, it is controlled, even then, it controlled it. But what else can we use it for? And somehow they pulled ADD, ADHD out of the hat, and they made a fortune. Just made a fortune. And they had groups all over every county in the United States where they'd invite the parents and they'd give them a talk and they'd tell them, this is how you fix ADHD, ADHD. And they did provide information, but the whole point was get those parents to have their doctor write Ritalin for their child. And as a result, it mushroomed. I mean, it was huge. The money they made on it was just unbelievable. I don't know who Ciba-Geigy is today. They're part of something bigger. And, but it was amazing to see that kind of success. And then when I tried to do competitive educational programs, boy, did I get some pushback from them. You know, would you like to come to our program and speak? Oh no, we don't want anything to do with that, because we were talking about other things. All they wanted was put that child on the drug. That's the answer to everything ADD and ADHD. And a very narrow kind of approach. And methylphenidate is Ritalin. There's your Ritalin. Methylin, I believe, is just a generic Ritalin. Concerta, long-acting Ritalin. Methadate might be a long-acting Ritalin, and the patch I don't know anything about. It's got to be Ritalin in a patch, is my guess. Dextroamphetamine, Adderall, you may have heard of Adderall, still comes from that amphetamine family of drugs. So it's going to have whatever amphetamines do to people. These drugs are going to do similar things. So what do? Well, right away they can cause sleep problems. And that can be a real problem if you've got a hyper child. So when it wears off, and every drug wears off, you might have some kind of sleep problem. And it could be, some kids get very lethargic and you can't wake them up. Other kids just can't go to sleep at night. So right away you've got a child the next morning, you know, they're getting crankier, they're not getting better. So that's maybe not a good candidate for the drug. That might be somebody that falls off the drug. It might go away in a month. I mean, I don't know if you can survive a month with that. Decreased appetite. Think about that. Decreasing the appetite of the child. Not such a good idea, I think. And decreased appetite also translates into poor growth. It keeps up. You know, reduced height. If they're thin all the time, it's hard to say. But it's an appetite suppressant. That's why it's what it came out for. That's what it originally was. Delayed growth, we talked about that. Headaches, stomach aches, that's pretty common. Rebound irritability when the drug wears off. So your child performs pretty well during the day in school, and they come home, and you get the rebound hyperactivity. And you go, wow, how do you handle this? You can't get more Ritalin at that point. So, ticks. Have you ever seen a child with a tick? There's all types of ticks. We used to see them, they'd suck on their t-shirt. They'd have a cough. It's throat clearing. They might actually make some kind of noise every few seconds. Often the drug causes that. Sometimes it just, they have it. And I've had to deal with a lot of ticks over the years. Moodiness, irritability, and of course suicide, you got to talk about. It is a possibility when they're on drugs like this. Not just the amphetamines, but sometimes doctors put kids on serotonin reuptake inhibitors, Paxil. They use a lot of Zoloft for kids because they think it's safer, and it may be safer than the other drugs in that category, but the suicide potential is still there. There's always a suicide potential with an amphetamine. Seizures have been reported. I can't say I've ever had a patient that was on Ritalin that had a seizure, but it's very possible. So, long-term side effects. Extreme weight loss. You can have issues where you think you have an anorexic person, anorexic child. You might actually, in theory, could cause an anorexia type of situation. Reduced sexual function, that would be more for adults. Gastrointestinal problems, muscle deterioration. It's kind of scary. The long-term use, that can happen. Think about it. Doctor puts your 10-year-old on Ritalin, and they got to get through high school, junior high, and they end up having some problems. And they go to college, and they go, well, no, I got to stay on Ritalin. And before you know it, now they're on this drug for 10, 15 years. They go into a job, they decide, I can't handle this job without the Ritalin. Now we're 20 years out on Ritalin. And that's where some of these other side effects will come in. The breathing problems, cardiovascular damage, chronic exhaustion, cerebral hemorrhage, stroke, seizure. It can get pretty nasty if you've been on these things for a long time. Now, some psychiatrists use Ritalin for depression. So, just it works for that patient. It takes away a lot of their symptoms. But it is putting their heart in danger. And that would be the number one thing that we're worried about, some type of heart disease, congestive heart failure eventually. So that's what you got to worry about. All right, so what treatments are available that we can do? Well, you heard the drug treatment, kind of something that your doctor has to do because it's complicated. What about diet? Well, we found, and I think you'll find most researchers have found, that a low carbohydrate diet seems to be better for a child with these symptoms, meaning more protein and more fat. Now, I've been experimenting, and I try to recommend a 70% fat, 20% protein, 10% carbs. It's pretty restrictive, but it's a pretty healthy diet for a child, and it really works for the brain. The brain needs fat. There's no benefit to a child's brain. Carbohydrate is not a benefit to a child's brain. It's the wrong thing because it's too much sugar, too much glucose. It'll make that behavior worse. So fat, and by the way, most of the supplements that we use tend to be some type of fat-based supplement that seem to make things work better. And we'll see that in a moment.
Doctor, isn't the brain about 65% fats?
Oh, it's
I heard
that's when somebody calls you a fathead, you should say thank you.
So thank you, yeah.
Wow, you got a little fathead. Good thing. Feingold diet. Bring that up because the test we gave you was actually made by Ben Feingold. Ben Feingold was really, he was way ahead of the curve, and he was thinking about these things in the 1950s. And he had special diets. Ciliates were what he looked at, and food additives. He thought they were causing it. Well, it may be true. There were actually Feingold organizations all around. They were in Bucks County, Montgomery County at one time. They actually had designated Feingold nurses who I've met over the years, and they try to help you do the Feingold program.
Well, I don't know what hers.
It's pretty difficult. It's not easy. So here's some explanation in your packet on that. In fact, that's what this is. And he had high points and low points. Nobody liked him in the medical community because he didn't talk about drugs. And everybody's being paid by drug companies in the medical. Your studies. Who pays for studies? Well, drug companies. And they're not going to pay for diets. Not unless there's some kind of money in it. So things get, pushed aside. There's no interest in that. What they pushed aside may be the most important thing, but it's money that dictates what we're going to look at. So that's how things kind of get askew. Why are we always working in this area when probably this has more sense? Well, there's no money for it. So that's the Feingold diet. And this is some of the therapies. I'll throw in some. you want to find out if your child has a lot of allergies. You probably need an allergist. And you should try to get those allergies under control because they can change behavior. So that's an important part. Sleep disorders. I'll give you an example. I had a child at Abington at the hospital, and we put him in our program. After 10 treatments, he showed no progress. Very unusual for us, because we screened carefully. So why no progress? I couldn't figure it out. So we always had one of the parents come in with the child when we do the treatments. And sometimes I'll question the parent, about something. Is he doing better? Is it worse? Whatever. And I just happened to start talking about the child's sleep habits, which are important. You'll see them in the final test. And I said to her, does he sleepwalk, and went through all that. And I said, does he make a lot of noise while he's sleeping? And turns out that she said something like, yeah, he snorts and makes sounds and all that. Really? And I thought, well, you know what? I just better quickly look down his throat and see what's going on. And I looked down his throat. It was like a horror movie. These giant tonsils were down there. And the doctor has never mentioned this to the parents. So these tonsils were the biggest things I've ever seen. They should have been like an adult man. So I said, all right, I'm going to refer you to a ear, nose, and throat guy that I knew. He went up there and he said, this is bad. This child's not sleeping at all. So they removed the tonsils, and that was it. This child didn't have ADHD. So it's important to go and look at some of these things. So sleep disorders. I do biofeedback at the hospital. We actually did neurofeedback. This is a way of training the brain to focus and have more concentration. That's important. If you can change the behavior and you make the child look better, well, that's just great. And you give them something that they have forever, maybe improve their performance. So that's what we do. I do that here. And then there's lots of supplements that we can use to treat ADD and ADHD. That's a little tricky. So you need some guidance sometimes. That's why we're here. Oh, and I have one small problem here with me. Couldn't get this formatted properly, so we're going to put it here. And what you see, so what you see are neurotransmitters, and there's 4 of them. Now the one on the right, where it says acetylcholine, mood, delta, serotonin, that's your serotonin neurotransmitter. Probably not something you want to, with a child with ADD, you don't want to be playing with that neurotransmitter. I mean, it's dangerous in a child. In an adult, you know what people do. They give drugs like Paxil and Zola, and in an attempt to improve the behavior of the individual or lift the mood of the individual. So you see their mood. I'm having trouble seeing. I'll look here. Visual, perceptual, reaction time. That's kind of things that serotonin do. And that one is not so important. We don't do much with that here at all. Then on the other side, this side, we have the frontal lobe, and that's dopamine, another neurotransmitter. And we don't do much with that. Now, I work with dopamine deficiency, but it's not going to be an ADD child. Almost never. So that one isn't that important to me. But then we have the 2 in the center. The one to the right, acetylcholine, I think you see that, and GABA. A lot of these products are geared to those 2 neurotransmitters. They're extremely important for focus, concentration, and processing. If you see on the parietal one, you'll see acetylcholine, and you'll see creative, immediate, processing up at the top. So what do kids have problems with, or what do adults have problems with? Kind of finishing their work. That's processing. So you're in a meeting, and your boss says, "I want you to do this, this, and this," and you go back to your desk. You just can't seem to, get this thing done. Well, that's a processing problem. So if you can improve your processing ability, you're going to look better. You're just going to be completing things. You're going to get the raise. All right. Now, the GABA neurotransmitter, the one on the right in the center, that's all about calming. And if you're calm, you tend to improve focus and concentration. So these two kind of overlap in some ways, but they're the two we want to work on to make a child look better in school, maybe an adult be more functional. So what we do with that, back. So on the last 2 pages, I believe, of the handout, you'll find the, right there. It'll be right after the lobes. You'll see something about GABA, or brain calming supplements. So the brain calming supplements, when I did this 15 years ago, I haven't updated too much. I can see I've updated a couple things. But GABA, number one. So GABA was part of that GABA neurotransmitter. Obviously a good one. 15 years ago, I only had GABA. We didn't have some of the things we have today. But GABA was a good one. It wasn't the kind of GABA we have today. We have a GABA now that crosses the blood-brain barrier, so you don't have to use massive doses of GABA. So, and that would be right there, Pharma-GABA. It's a great product. This is a cornerstone product if you want to treat ADD, ADHD. Really a good product. And this particular one is excellent. You can get this in a chewable, you can get it in capsules. Over here, this product, more recent product, is actually only a couple years old, I believe. You know what? It might even be less than a year old. This is a combination of GABA and L-theanine. We'll talk about L-theanine too. But this is a way of getting something into somebody that can't swallow capsules, doesn't want to chew the chewable. It's a spray on the tongue. It tastes pretty good. So there's a lot of versatility to the products now that I didn't have any of these things at the hospital. Just didn't have them. This is, by the way, if you look at this again, you'll see things like inositol. It's a calming type of thing. I don't usually use that often. It can be mixed into some ADD products. Glycine is a precursor to GABA. It could be mixed in with a product. Calcium, maybe, it's something I don't pay a lot of attention to. Iron deficiency in children, that can be, if you add a little iron in the form of a supplement, sometimes they can actually do quite a bit better. So iron can be important in some children. 5-hydroxytryptophan is 5-HTP, which, I don't know if I have one here, that's a serotonin stimulator. And I don't like to use that too much with ADD children, but in an adult, it could be very helpful. So 5-HTP is a great thing, particularly in an adult. There's D-L-phenylalanine. I don't know, that's something that has never been, my peers don't use a whole lot of it, but I do notice, it's a good pain reliever, by the way, but I do notice that it's very good for focus. So it's something else that might be helpful. Glutamine, kind of part of that GABA neurotransmitter. So that's the kind of thing we're talking about. Now, let me back up a second. Conditions related to loss of brain rhythm. On that lobe chart, I think they talk about brain rhythm. So if we can put the brain into rhythm, a healthy rhythm, believe it or not, your brain beats, one side of the brain beats at a slightly different pace than the other side. It's not like when the blood goes through, it's going like this. It actually goes, it's just a little off. And the closer they are together, at least in theory, the more functional the brain might be. But if it's beaten, if the beat's real far apart, it might be an issue. And there are people that look at these things. Also, there's a therapy I didn't talk about, and you don't see it too often. But I use this with a lot of the kids. Rhythm therapy. All right? Rhythm therapy and the two sides of the brain. Kind of incorporate that. And we have some exercises we teach for this rhythm therapy and cross-brain activity. So there are actually people out there that have a device, and it's like these electronic gloves you put on, and there's a metronome, and they clap their hands and try to be close to the speed of the metronome. So, just to give you an idea how we did it, at Abington we actually had that person come in and treat people, but the first time she came in, she hooked up the unit and she says, I'm going to check you guys. And it was my partner and I. We're both musicians. So she puts us on there, and it's like 99%. And I said to my partner, I said, are we surprised? We're going to be right on the beat. And then my partner said, yeah, so what is it, what does this get us? I said, go out there and get a bunch of our kids in the waiting room and let's put them on here. So we brought back 3 or 4, put them on, and guess what? 82%, 83%. We couldn't get any in the 90s. These are documented ADD children. So I stood back and I thought, you know what? That kind of makes sense to me now. So there is a rhythm thing, and it's something you might want to pay attention to. Sometimes I'll have a parent buy a metronome and actually have the child, practice clapping to the metronome. And believe it or not, it seems to improve. I wish I could give you real scientific stuff on that, but nobody wants to look at that. There's no money in it yet. The rhythm therapies, nobody wants to look at that. My gosh, what if you cured every ADD by having a child clap their hands? That'd be kind of really crazy, right? It would exclude every drug on the market. It would be a problem. Okay, let's go to, that's the brain comic. Now this is the acetylcholine neurotransmitter. Again, I told you it's the processing neurotransmitter. It's very, very important. By the way, acetylcholine, GABA is a protein, and acetylcholine is a fat. And it's the fat that helps the synapses in your nerves deliver information. It does a whole lot of things. It heals the myelin sheath. It heals the brain. It's just a very, very important fat. And if you have a acetylcholine deficiency, it's just not going to function very well. We're talking about recall, attention, speed in your processing. Your symptoms might be, by the way, it could be cravings. You give acetylcholine, you load an alcoholic who's recovering with acetylcholine, sometimes they can have a lot of relief from it. It can be very effective. Acetylcholine in the form of, let's see what form we have it, phosphatidylcholine. I give that to a lot of patients for a lot of things. I give this to MS patients. Why? Because their myelin sheath is damaged. Their synapses and their neural transmissions damaged. It does the job. It fills in. So for someone that's got ADD, it's perfect. It just really does the job. That's the GABA. This one here, Brain Vital. It's a combination product, and this one actually takes care of the GABA neurotransmitter as well as the acetylcholine neurotransmitter. This particular one would be very good for adults because it has a lot of help for memory. It's a professional product. It's not to say that just a little GABA might do the job for some people. Yes, well, most of the ingredients here do. This does. This, of course, does. This is DHA, which is a lot like phosphatidylcholine in that it's in the phospholipid group. You'll hear that term, phospholipids, fish oils, that type of thing. DHA is a fish oil. It's a little fish oil is made up of EPA and DHA. Most just straight fish oil is higher in EPA than DHA. So that's not really the one you want. You want the one that's higher in DHA. Now, cod liver oil is higher in DHA. And so, and this particular fish is designed to be that way. So that's a possibility. In that same category on the acetylcholine side, let's go one more slide up. The conditions we're working on: senility, dementia, Alzheimer's, multiple sclerosis, ADD, ADHD, autism, all those other conditions on the spectrum that they're always talking about, head trauma, concussion. Really a good group of a lot of indications for this group of products. A diet rich in choline. All right, so what is that? That's a high-fat diet. So that's why the high-fat diet is so important. Over here, you'll see acetylcholine deficiency. Magnesium seems to be helpful when you have that problem. L-carnitine being one of the amino acids, GABA, inositol, again, a calming type of B vitamin. Fish oil, I think fish oil like this, it's high in DHA as opposed to the EPA, the ratio is different. Phosphatidylcholine, cod liver oil, B12 always is helpful, although that's not specific. L-tyrosine would be, if you have a child that is kind of, doesn't have energy, kind of the ADD that's kind of almost like can't get up for the class, tyrosine can be helpful. That's pretty uncommon. DMAE is a fish derivative product that is very effective for most people. It's just issues of flavor and things like that. Will the child take it? This product, phosphatidylserine. This is made from phosphatidylcholine, but it's very specific, and it does actually, I think, at times a better job than phosphatidylcholine. It's not as versatile. It tends to be really good for ADD and ADHD, particularly if you have processing problems. It seems to, if you have someone, an adult or a child, who has a lot of mood swing, that might be a very good product for that child. Let's face it, if you can improve the child's kind of mood, their behavior in class, the teacher kind of looks and goes, oh, this child's doing better. They may not actually be doing better, she's just happy that the behavior is better. But at least you're making progress. Yes?
Is it like an outward or is it like a short?
No, they're going to be...
Could you repeat the upfront questions, please?
Yes. How can you identify the mood swings? They're pretty identifiable.
Is it like reserved?
You could be very quiet.
Quiet?
Yeah. And then 10 minutes later, they could be jumping all over the place or screaming. You don't want that, obviously, So even in adults, I find that if I use phosphatidylserine, it's going to level that out. It makes it better. This is a patent item. All right. When something's a patent, sometimes it's a little more money. This bottle, I don't know, $12 or $13 for 100. Pretty reasonable. Suddenly, this might be $20 because it's a patent item. GABA is a patent. Pharma GABA is. Regular GABA is not. So, but you don't want to use regular GABA anymore. It's too old. It doesn't do the job. Pharma GABA is a patent. Is it a few more dollars? Yeah, it's just a few. Actually, they've kept the price pretty reasonable. And by the way, if you want to work the GABA neurotransmitter, and you have somebody with a lot of hyperness, somebody who's agitated, that type of thing, sometimes, as you saw in this product, they mix L-theanine with GABA. but this is just straight L-theanine. A lot of times, if the child has or adult has a lot of anxiety, and it translates into a lot of, you know, inappropriate, they can't sit still, that kind of thing. Sometimes L-theanine is a better choice than GABA. They both work in the GABA neurotransmitter, but sometimes L-theanine is a better choice. Right away, you should be getting the idea that this can be very hit and miss. You try this one, you try that one. You don't always get it on the first try. And honestly, I've been doing it for 20 years, and I still can't be sure when I send somebody out with a GABA that it shouldn't have been L-theanine. I ask a lot of questions, I get a picture, and I take my best guess. And if I fail, then I know I should have used L-theanine, or whatever. Or sometimes you got to work both neurotransmitters. It's not unusual for me to add phosphatidylcholine to GABA or L-theanine. It just works better. So it's not a, you know, I can't tell you, my child does this and this, I should take this. All right, it just doesn't work that way. You've got to be loose, and you've got to be willing to experiment. You get the right one, you'll be amazed at the difference in the child's behavior, and you'll be really pleased. And an adult, a lot of people would come to me. I used to do training for corporations, and it involved a lot of things, including job interviews and things like that. How do you perform at your job interview? I want to perform better. What do? Well, we would do special training, but a lot of times I would just give them phosphatidylcholine, and that was enough for them to go into an interview and look better, perform better. So, you know, for 2 a day for $12 or $13, they're happy, you know, and they're doing a better job. So you'd be amazed how easy it can be sometimes. And there's other times where it gets very complicated. Now, more questions? Yes.
Here's just a statement. My brother's kids had the mixing chapter stuff in their writing, and they don't like much. And when I did my homework, I found that I was confusing responsibility quite often. And then once I expanded that went away.
All right. You were kind of describing our question here is almost like a dyslexic type of thing, which turned out to be a little different when the behavior was corrected. Yeah. Yeah, basically, you know, you made the example for them, and their behavior came in line. Yeah, that's okay. But if it was truly a dyslexia issue, you'd need a lot more intervention. So that's not dyslexia. Yeah, I would say that's more behavior. And you got to deal with that. There's a behavioral issue. You got to remember, if you listen to my daughter's comments, she was being beat up by her teachers and other adults, by the way. You know, why can't you do this? Why are you using a calculator? Well, because she can't do it. And nobody took that into consideration. She should be performing like every other kid in the platform. That's just not the way it is. I remember in the 50s when I went to school, we always had 1 or 2 kids that weren't doing as well. You know, we didn't know what was the problem, but it may very well have been ADD, learning differences is what we call them. And I think the term learning disability is kind of not what it used to be. So we call them learning differences. And they are differences. I think it's more appropriate. So, you know, not everybody is going to be a nuclear physicist. Not everybody could be a brain surgeon. It's a funny thing about surgeons. If you ever watch them work, it's exhausting. I never do it. I mean, my back would be hurting. It's terrible. You know, so you can be a special person to do that. You know, other people sit and work at a computer, and that seems to fit them, and that's great. Other thing I want to talk about here real quick before I take some more questions. Exercise, all right? As part of that rhythm thing and part of cross-brain activity, the type of exercises that I suggest for ADD children would be running. because generally they do have problems with coordination. And running is a rhythmic activity, all right, and it's a cross-brain activity, the back and forth thing. So it's very effective in getting that brain to work a little better. So I always suggest they get into things like martial arts. I love that, and it's very effective. Running doesn't take a lot of coordination. It's just about about getting the rhythm down. And you do that, little things like that can really. And by the way, it improves their own self-worth, and they become just a little more under control, and they just feel better. Yes. Okay, adults and exercise. Same thing. That cross-brain activity, get out there and walk. Out in the sun and weather and wind, it will improve everything. It really does. And there is something about, I have a test, and I guess I should have pulled it out, but it's very simple. It's a card. One side of the card has two parallel lines. If you flip the card over, it has an X. Big X. So what we do is we have the child put their arm out to the side. We feel the resistance. Don't let me push it down. And then we'll do that on both sides. And then we'll show them the parallel lines. And we'll say, okay, let's do the same thing. Don't let me push it down. And no problem. They never have a problem with the parallel line. Then we flip the card over and we show them the X. And then we do the same thing. Maybe 1 out of 10, we discover this thing where one arm can't stay up looking at the X. And then what we do is we will do a series of cross-brain exercises, and we'll have them come back. It might take 2 or 3 months. And all of a sudden, that goes away. So what we're trying to do is get that cross-brain activity to work better. The X throws them off, throws the brain off for some reason. When I saw this, I had he's a PhD psychologist, I believe, came to our office for one of our ADD meetings that we used to have at Abington. We would invite practitioners from all over. He pulls this thing out and demonstrates it. We all looked at each other like, oh my God, we got a voodoo guy in here, right? What is that? So then we started doing it on our kids, and we realized this really does identify something. So we've kept it. I don't know what that's, what is behind that 100%, but I do find that I use it and I do identify a child like that, and I make sure that I get that cross-brain activity more effective. And, it's a sign for me that I need to work in that area. And, what's it cost? $0. You need a ball, maybe a large ball and a small ball. We teach you a few exercises. Maybe we suggest they run a mile every day. It would be that simple. My daughter, instead of running a mile, within a month, she joined the cross-country team and was like a star right away. She just went crazy because she loved it. It made her feel better. It made her feel so good, she overexcelled. So before you know it, she was, running everything. And to this day, I can't stop her from exercising. So you'll see her in magazines. She'll be at expos. She talks about ADD, throughout the country. She found a niche, and that's what every kid has to do, I'm sure. And it makes her feel better. Any other questions? Yes. Okay, so no, anybody can go get the GABA and at least try it. Now, if you fail, then you might want to come in and talk about it. You might feel that your situation's so complicated that just grabbing something off the shelf may not be the way to go. You might need a little guidance, and we're here to give you that guidance. You may need to come in and sit down for an hour and let me do an evaluation and see what we're really looking at. Now, you have the Feingold inventory. What I'm going to do, before I forget to mention this, is anybody who wants me to look at that and give you some kind of a diagnostic guidelines from that test. I'm going to stay. We'll go through everybody that wants to do that. I'll look at everybody, so I'm not going to leave until we look at whoever wants to look at it. And believe it or not, that inventory was our tool at Abington to screen out people or screen them in, depending on, do we want them as a client. It's really accurate. You just got to know what you're looking at. It's not for everybody, you just can't come off the street and say, yeah, I see, this and that, and it's the GABA neurotransmitter. It's a little harder than that, but you look at it long enough, you can kind of put two and two together. So we're going to do that after we're done here. Now, any more questions? I thought I saw another hand. Yes.
I'm learning so much. I mean, this is something that anybody can benefit.
Well, kids can't do that.
No, but you say exercise. You can't exercise. You have to have exercise. And you might not need all of these supplements.
Because if you're 10, start this one. You're about to enter the biggest growth period of your life. All your sexuality is set. By the time you're 18, you're going downhill already.
It sounds designed for that.
And so...
Yeah, can you restate that? We can't hear what's going on back here.
I'm going to restate.
Okay.
If you follow the Feingold diet, you can ever do Ritalin. What percentage never did go into all their heart stuff? I mean, I can understand why their heart, everything is muscle. And heart is such a big muscle. It's like, you just did yourself in. It's what I'm beginning to think. And I just want to...
Okay, so the heart damage created by Ritalin for those kids that did develop heart problems versus if you were just on the Feingold diet or something. I don't think there's good information that where we can compare the two. We know that kids on special diets don't have an increase in cardiac problems, so that isn't an issue. On the other hand, we know that Ritalin causes heart damage. Now, what percentage of children that took Ritalin develop heart damage? That's going to depend on how long they took the drug. If they only took it for 3 or 4 years, no problem. If they took it for 20, they might have a congestive heart failure by the time they're 40. That might be mild, could be bad.
Why don't they just start it and do it on rats?
Why don't they?
Just do rats. Do a rat study now, since they didn't do it along with the rats.
Okay, so why don't they do a study now on Ritalin or other things to see what that heart damage is about? Ritalin's a generic drug. Nobody's going to spend a dime to find that out. Now, maybe if some foundation says, well, let's do some kind of an in-depth study, we'll fund you. Yeah, you might get one study, but you got to remember, journals, where you have to have these things published, they don't want to see your first study. They want to see repetitive studies. They want you to prove somebody else's work. That's more important to them. And nobody does anything in the medical community unless there's 20 studies that say, yeah, that is true. All right, that you got to prove it over and over again. It's that repetitive, it's part of that, the way Hippocrates set things up as far as the medical view is it's got to be reproducible. And these studies, if I've got a theory and I do my first study, nobody cares. We want 5 other people somewhere else to do it again and make it come out, see if it comes out the same way. If you can do that, you've proved something. But as far as trying to look at diet, people that are using diet to control anything aren't increasing their chance of cardiovascular problems. In fact, they might be healthier. Somebody who's using drugs, a lot of drugs do beat up the heart. Statins, even though they're, the promotion is that we're saving your life by giving you a statin. Statins do have cardiovascular risk. They beat up the heart. And long-term statin use, somewhere And you know, when you're older, if you start when you're 40, by the time you're 65, 70, you may have started to develop congestive heart failure. So drugs have these hemodynamic effects, and they can hurt your arteries and your heart. So that's why giving a child an amphetamine to fix ADD is kind of a crazy thing. But you know, that's what majority of people believe. Other questions? Yes, sir. I know you. Okay, so good point, because you're saying statins cause irreversible muscle damage. Well, if you noticed on one of the slides, we talked about Ritalin causing irreversible muscle damage. So a lot of drugs not only beat your heart up, your heart's a muscle, so it's beating other muscles up. So you've got someone on Ritalin for 20 years, and you notice they are not the greatest. Their balance isn't so good. Their legs are kind of skinny. What's going on here? They don't have the muscle mass that you would think a 30-year-old or a 40-year-old would have. Doctor never says, "Were you on Ritalin as a child?" He'll never say that. It's never going to happen. It won't be unless somebody mentions it. It just won't show up in their history. It won't show up in their file, and nobody puts two and two together. So there you go. Boom.
Now, it's mostly adults that have it. What percent is it? I mean, it's mostly children that have it. What percent are adults that have this ADD? Any idea?
I don't have anything on that.
Yeah. And how about
you got to remember, very often, by the time you become adult, you've slipped through and nobody identified it. So it could be pretty big.
What about caffeine, as far as?
No, good point. So it's a good way to kind of describe the drug thing, too. Caffeine, 1 cup of coffee is equivalent to 5 milligrams of Ritalin. So if you give a kid a cup of coffee before they go to school, what you've done is a small dose of Ritalin kind of effect. So you've made them a little more focused, a little more calmer. Now, this is a good point to bring this up. So why does Ritalin work? Why if you give a child a stimulant who's already hyper, would they look better? Would they seem calmer? So it goes back to, let's see if I can go back to, oh, I can't. Yes, I can. Okay, so if we go back here and we look at an ADD child with those 2 center ones, and what are we doing? We've got a child that their brain waves would be in theta and alpha. All right, that is not, they're not hyper brain waves. And theta is a pre-sleep brain wave. So if you've got somebody with GABA issues in that neurotransmitter, you're not totally awake. You're actually almost like a pre-hypnotic sleep. So what is a stimulant doing? It's waking that child up. It's making that child more awake. And what a child is doing that's banging their foot on their chair in the classroom is they're trying to keep themselves alert and awake. That's why they're doing that movement. They're shaking themselves into wakefulness, or they're trying. It doesn't work. But if you give a child a cup of coffee, caffeine, you give a child GABA, you give a child methylphenidate, Ritalin, you are waking that child up, and suddenly that theta brainwave moves over to maybe alpha or beta. If we move it to beta, that'd be great, because that's a healthy place to be if you're in a classroom. So brainwaves, if you were to look at brainwaves, think of it as a big long group of brainwaves. Beta and gamma are up here. You don't want too much gamma. Beta is a good one. Alpha, theta, delta. Too many delta waves would make somebody very sleepy. You just don't see that. That would be like sleep apnea, that type of thing. Pumping out too much delta waves in the daytime. However, when we would measure somebody using brain scan, brain mapping, we call it, and we actually measure the brain waves, we look and see what's the delta average while they're awake. The delta average, if the theta averages are high, that verifies you've got an ADD child. So it's not like you can't measure this. If you've got the right equipment, you can actually spot it. It's just that's very expensive and hard to do. And I do a similar test here. It's not quite as involved. And you can actually see that they're pumping out the wrong brain waves. So what do? You give them GABA, you give them phosphatidylcholine, suddenly they're into a healthier brainwave pattern. You see more alpha and more beta as being dominant. Suddenly the theta and the delta go down. This is how neurofeedback works. And neurofeedback can be 40 sessions. You're talking $110 a session. Ends up being $4,000 treatment. You got to come twice a week. Some places want you to come 3 times a week. And it gets very involved. Most people are not going to commit to something. Any other questions? Yeah.
If someone is on like prescription medication for ADHD and they're trying to go off of it, how long do you activate, and then should they be like starting down therapy or also doing something?
Okay, so that's a good question. You know, most drugs have withdrawal problems. And so what she's asking is, if you're on Ritalin or one of the ADD drugs, can you just walk away? How do you taper it down? What do you do? Well, you might have to gently taper it. You don't have to make this. Every drug has a different rebound effect. Ritalin's is pretty short. So you can get off of them within a week. Maybe even the same day. Some people do it cold turkey. But, you know, like a statin, you can walk away from a statin. It doesn't seem to have much other than your cholesterol might rebound. On the other hand, you walk away from a antihypertensive drug and your blood pressure will shoot through the roof and it could kill you. So you have to be careful withdrawing from some drugs. The serotonin reuptake inhibitor drugs, Paxil, Zoloft, they have horrible withdrawal effects. Very hard to withdraw from something like that. The barbiturates, Xanax, Klonopin could kill you in a withdrawal if you don't withdraw carefully. Fortunately, the methylphenidate, you can kind of taper it down, and you can use supplements at the same time. I'd be careful, but you can use GABA with it. L-theanine should be effective. There isn't anything you can't use the acetylcholine products with. There's nothing. I don't care what your condition is. You can use this and it'll make you feel better usually. Or phosphatidylserine, either one of those. Any of the fish oils can be used with the drugs unless it's a blood thinner. Then you got to maybe worry about it. So yeah, you do have to be careful, but no, you should be able to walk away from the ADD drugs without a whole lot of problem. You can use supplements at the same time. Anybody else?
Do most of the drugs inhibit the diet, the eating? Which one is going to do that? You're taking it like something?
Yes. Can do most of the drugs that we would give for this cause problems with eating? They can. Not everybody responds that way. I think I've seen 1 or 2 kids who will start Ritalin and they'll just go into a deep lethargy. It's totally inappropriate. You got to stop it. But they also stop eating. Now some will look just fine, and you don't get that lack of food. They're just eating less every time at the table, and you don't see it till all of a sudden you go back to the doctor 3-4 months later. Wow, they haven't gained any weight, you know, and they're a kid. What's going on? So sometimes it can surprise you. You don't notice it. And you can see why. I mean, they're sitting at the dinner table, they look like they're eating, they're just not. So you got to be really careful. We're talking about children here, and we're talking about starving.
We have a friend and he doesn't eat it. He's anorexic, but he's so wild.
Yeah. Yeah, and that's a problem.
I need to see you.
Well, you know, sometimes there can be children that are just really, you know, their impulsivity and all. And sometimes drugs have to be the answer. But, you know, it might be worth looking at something else first before you make that leap, because it could end up being pretty harmful. You know, you have no idea. You know, it's like putting a person in a prison camp and starving them. I mean, it's the same effect. It's nutrient deficiencies start adding up, and everything can go wrong. They can start having visual problems because they don't get enough vitamin A. B vitamins go out of whack. Their behavior could get worse. I mean, it could get pretty scary. Yes. Oh, was that a hand? No, that wasn't a hand. Oh, there's a hand. Okay.
So, you like L-theanine, which is tea.
Well, L-theanine comes from green tea. It doesn't have any caffeine in it. And it's a protein they pull out of green tea. It probably, a lot of green tea gets killed making L-theanine, I guess, or something, because it must be hard to do.
So I know white tea is beautiful on the scale of white and black. So what about white tea?
To do what with white tea?
All right,
I mean, it's not therapeutic for what we're doing.
Nah, okay. So I was going to something called quercetin.
Quercetin, okay.
And quercetin is highest in white tea. And I wanted to know.
Okay, quercetin, I'm glad you brought it up. A lot of children will have problems with the gut, and they may have gut permeability, leaky gut syndrome. And that's not a good thing to have for any child, but with an ADD child, it might even be more problematic. It's going to cause inflammation. It's going to be a lot of problems. A lot of kids who have ADD will describe stomach distress. So you got to start thinking, maybe there's something there. And quercetin and the other bioflavonoids do a nice job fixing that problem.
It's also good for allergies.
And very good for allergies. And why do we have allergies? Probably gut permeability, leaky gut syndrome. So I like it. I think quercetin with bioflavonoids is a really important part of this kind of thing. And by the way, I forgot one other thing. I don't have this in the lecture slides, but this is CBD oil. So CBD oil is a cannabinoid type oil made from a type of cannabis plant. And there's no THC in it, but the calming effect and the other effects of CBD oil for a child with ADD might be worth the trouble if these things fail. I don't think you should go to this as the first thing. First of all, more expensive, and you know, it's a dropper. They may not like the flavor. I mean, it's complicated. But if you've got a child, for instance, that isn't responding to other things, terribly hyper, it might be time to look at CBD oil along with maybe a GABA, acetylcholine. I mean, you can fill up those neurotransmitters and make them work for you. They'll be stopping you from doing that. The doctor can't actually give you much for the GABA. In fact, I don't think the doctor can give you anything for the GABA neurotransmitter. There probably is some acetylcholine product nobody uses. I don't know what it is. In the amantadine neurotransmitter, that's where CBD oil works. Other than cannabis, what is there? I don't think anything. If other things work there, they're in minute amounts. It's not worth the trouble. That works on that neurotransmitter. Nice thing about that particular neurotransmitter, it is a calming neurotransmitter. It makes children feel better. It works for anxiety. I don't know if I said this earlier, but show me a kid with ADD and I'll show you a kid with anxiety. There's no way they don't have anxiety. Yes. Well, if you're talking psychosis and other things, we use it in that here. And we sell a lot of CBD oil. But for ADD, it's like the third step, maybe the fourth step, you know, when you're trying to get things under control. So that's a whole lot of interesting things that you can use before you go to a prescription drug. And by the way, I noticed that when kids are coming in today, it's not just Ritalin. I mean, I'm seeing all the antipsychotics that they're hoping works for ADD. I'm seeing, I think for some reason, a child was on Depakote, which is a seizure drug, and I think the doctor is guessing that the child has ADD plus depression. And that's maybe why, I'm totally guessing on this, but I'm pretty sure that's what it is. He's giving them Depakote. Now, Depakote will destroy your liver. Give it to a little kid, how long are you going to be able to keep that little kid on Depakote before they start having liver problems? So, you know, it's kind of crazy, but they'll try all kinds of things, and sometimes, more than sometimes, doctors will say, we've tried everything, go to the health food store and see if you can find some. I mean, really, give me the worst case, all right? And you know that he doesn't know what to do. So what's he do? He pushes it off on the guy down at the health food store and expects us to pick up the worst case for him. And sometimes we do, sometimes we're successful. So, you never know. Yes? Okay, what about Buspar? What's the, I used to work for that. What's the, Buspar is, well, it's anti-smoking product. Yeah, originally came out as, I can't think of the brand name. It'll come to me maybe. But, well, Buspar is the brand name. It's Buspar, I think is the generic. And it was, I think, originally brought out for depression. Could be wrong. By Barrow's Welcome. When I was with Glaxo, we bought Barrow's Welcome. So we inherited the drug. I never worked on that drug, so I'm not so familiar with it. But I will tell you this, it can cause some real lethargy. I mean, you can put somebody in a chair and they'll never get up. So that's one of the bad side effects. For some people, we just had somebody in here the other day, and that's all they take, and their depression's fine, and they're under control. So you never know. And of course, they use it to help stop smoking. And I think that, you know, suicidal thoughts, you can get pretty weird on that. So it does have some side effects that are pretty troubling, and maybe it's harder to use than, say, Zoloft and Paxil. More complicated, I think. I just wouldn't even get near it. Yes? The whole family's in. Did you stop smoking? It might be fine. Hmm? You never smoked? Yeah.
But I also think anxiety.
Yeah, you can. Any of these drugs can be used for anxiety and depression.
But it also can be used for relaxation too.
Yeah. It could be. These are pretty. When I say they're versatile, doctors are really experiment with these things. And sometimes it's not in the package circular. The FDA has not approved it, and doctors use them anyway. Doesn't mean it's the wrong thing to do. They're just trying. You asked. You wanted to ask.
They were saying.
You know, big risks for a child, not so much for an adult. You wanted to ask me something. It's okay, so if you start with the supplements, how long are you going to have to stay on it? You may have to stay on it forever, because you've got a condition. It's a condition, it's not a disease. Let's get that straight. If you want to perform better, and that supplement does that for you, maybe that's your vitamin. All right, you may need to take it every day. Maybe on the weekend you don't take it. A lot of people don't take Ritalin on the weekend. That actually is probably a good idea. And then when summer comes, why have your kid on Ritalin for? You know, give them a break. It might save their lives. But with a supplement like, you know, like GABA or if anything, if you're using the acetylcholine products, you're doing yourself a favor health-wise. I mean, these things are really good for you. This would be extremely good for you. So there's nothing wrong with taking those supplements over really long periods of time. There's no damage. Now, you go talk to your pharmacist, you talk to your doctor, they don't know what to say because they don't understand it. They're too busy. I mean, let's face it, they have a dangerous job diagnosing, they got to keep you alive, they have to figure out all these drugs. When are they going to find time to learn about this? So what do? Very often, a lot of them start wising up. They say, go to the health food store. Maybe there's a nutritionist there or somebody that can help you with it. That's okay. That's fine. And again, we do treatment here for you. So testing, treatment, a whole lot of things we can do for somebody before they get involved in a drug therapy. Yes. So good point. Should we come here first? All right. I showed you that picture of the kid that had the ADD, ADHD stamp on his head. It may not be in your best interest to have a doctor in the school diagnose this. Because once you're labeled, you're going to be stuck with that label forever. And it may interfere somewhere in your life. Insurance, maybe on a job, they check your medical history, it may go, it may be a negative. So you may be very reluctant to get the diagnosis. You might come here first. And who knows, we put you on GABA and nobody ever knows this, and then you just keep going. Nobody's ever going to find out. It is a possibility. So there are negatives to being diagnosed by a professional. Uh-oh.
Well, shared medical. Once you get it locked down, it's available for every doctor.
I'm laughing because I remember that Seinfeld episode where everybody had, what's her name's history somehow, everywhere she went. Yeah, maybe that Seinfeld episode is way ahead of the curve, 15 years maybe. But once everything's in digital, which they didn't have during the Seinfeld era, or at least they were just starting to do it, who knows, Maybe all that will end up in one spot. You walk into your doctor's office one day and he goes, "You just downloaded all your histories from every doctor you could." Uh-oh, boom. What's that about? And then every time the insurance people come out to give you insurance, or you have to go to them and have a physical, they go, "Oh, but you have a history of," so you have to pay $100 extra a month for your insurance. Right? So, yeah, this digitalization and getting all this information in one spot might not be such a great thing all the time. They say, well, if you get rolled into the emergency room, we know if you're allergic to this, and if you had some heart attack a few years ago. And I guess all that sounds great, but it could be really used against you. Yeah, absolutely. I saw the bells and the lights going off in your head there. I can see that. Very good.
I just wondered when you were out. Because I had it my whole life, right?
Mm-hmm.
All the things.
Yeah. Yeah.
I wouldn't go there.
Yeah, well, think about you take your child to a pediatrician. What's his expertise in ADD? Maybe he did a residency in some kind of learning thing, CHOP or one of the better places. Maybe he did that. Or maybe he just, maybe he just did a residency in pediatric gastroenterology. And he's a general practitioner type pediatrician. You come in and he goes, yeah, we'll give him we'll give him methylphenidate, we'll give him long-acting, whatever it is. He tries that. You have problems, you go back and say it didn't work. The child became agitated. And he goes, well, you're going to have to go down to a neurodevelopmental specialist and have, a couple $1,000s worth of testing to find out what's wrong. That'll be his next. If I was a doctor, that's what I would do. Well, how do I know? Well, we know on the hospital staff, we have a neurodevelopmental specialist for pediatrics. Well, we're going to refer you there. You know, you've got good insurance. And that's how you end up somehow going through the system and you keep around. And, you know, you spend, let's say you spend $2,000 or $3,000 at the neurodevelopmental person, and then she goes, well, we didn't find it. Now what? That's when you're going to have to go to health food. All right. Yes.
Any of these supplements
Okay. So Prevagen's wonderful for memory when there's some neurological type things going on, like Alzheimer's, dementias, maybe poor blood flow because of restricted carotid arteries. There'll be a lot of reasons for that. Prevagen tends to work in that area. You give Prevagen to a child for ADD, it's just not going to be the same. It works significantly different. Yeah. Now, if you're an older person with memory issues, you might use Prevagen and phosphatidylcholine. That's logical. That's a very logical combination. So, or phosphatidylserine. So that makes a lot of sense. Or fish oil with Prevagen. So that makes sense, but it's not an ADD thing. Okay. Anything else? Anyone else? Yes, ma'am.
With these labels for children, all this testing and all these things that you do, why is it that the school teachers and the schools just simply put a label on you and say you're not right, and nothing ever really changes? Instead of educating maybe people about it, why isn't that brought forward to do that?
You know, once you get into the politics of the school, you're dealing with money, services. Every child they label ADD, ADHD costs them extra money. So, if anything, at least in my history, I don't know what they're doing today, but the history to me has been, we don't want to label you ADD. We might give you what do they call, an assistant teacher. We might give you an assistant to help you with math. But they may be reluctant to go ahead and actually label that child ADD because there's money issues. There's political issues. You know, the principal might be saying 2% ADD. We're not going past that number. That's what the state says. Or, you know, something like that. They may actually have their limits, and they're not going to let that. They don't want to be the principal that has 5% ADD in the school district. It makes them look better. So there's a lot of politics in what goes on at the school. And I don't like to get involved with that anymore. I used to. It was a waste of time. Anybody else? Oh my gosh, did we pan out on questions finally? Mm-hmm. That was a lot of questions.
Well, we have everything pretty much on sale, so you know, generally speaking, 25 to 40% off. So it's
related to ADD, memory, cognitive dysfunction. This is the CBD oils are always on sale. Yes.
Do you have a write-up or a sheet you could give us on supplements that you would buy for this?
We probably can come up with something on just pretty much everything. Yeah. We have good information on all of it. Somebody put a melatonin here. Remember what I said about sleep problems? Melatonin actually is very helpful for a child in particular that is having problems with sleep, because the serotonin effect that melatonin gives you will help keep the anxiety under control even in the daytime. There's kind of a residual. This is kind of getting out there. That question usually comes up with when we do the Feingold thing. So we'll look for that. I don't know how many people have done the Feingold inventory, but I'm going to stay here and we'll go over each one of them with you, and we'll try to give you an idea of what's going on in the child or the adult that we look at. Any other questions? Yes? You might want to call just before you come over, and and see if I'm not tied up with a client. If I'm tied up with a client, we'll push it back an hour or whatever. But usually we can get you in pretty quickly. It takes about 15 minutes to do that. That's really more of an adult thing. Now there are some children who have are very heavy, and it wouldn't hurt to measure them, especially if they're having cognitive problems, and it might pay to check that out, because it might be a blood sugar issue. It may not really be ADD. So remember, when the blood sugar crashes, right, blood sugars are not like this. They go up and down and up and down. So blood sugar crashes, behavior can get really weird. So all of a sudden the teacher's there, the kid's been sitting there 2 hours in class, behaving pretty well. Suddenly he's dancing on the desk. Well, that could be a blood sugar thing. That's why we rejected 50% of the people in our program at Abington, because we would discover all these other things. Even if they had ADD, I don't want to deal with the blood sugar. Send them to somebody who can control that, then come back and maybe we'll look at it. But there's a lot of issues and a lot of problems. If you have a family situation where this is so common, there's a divorce going on, and they're coming to us to have treatment for ADD. Not a good thing to do. It's a bad time to do it. So that would be a rejection. Not necessarily here, but in that program, yes. We wanted to be, and we would like to be 99.9% successful. Well, how do you do that? When you cut out all the variables and suddenly you look pretty good. And why not? They're paying $4,000. Let's get them done correctly, or say, look, we can't help you. Just trying to be fair. And there's some kids that have every one of these things. Blood sugar, they have anxiety, they may have depression, they may have ADD, and who's going to handle that one? Where do you start? So we were a limited practice. And even here, I'm not going to, I get a kid with depression, I really don't know that I can help. A little anxiety, yes, but depression can be difficult. Okay, another question. All right, maybe we've hit it. So just stay around the store. I'll be right here and I'll start looking at the tests and I'll give you an idea what's going on. And I want to thank you for coming. And yeah, and anytime you have questions, just come in. That's why we're here. All right, thank you.